for your time, everybody. My name is Jill Wilson. I'm going to apologize in advance. I came down with a lovely cold for all of you today, so bear with me as I present to you. It really is my pleasure to be here. I think we are InSites' newest customer. We went live 4 weeks and about 2 days ago, so we are very new into our implementation, and I'm pleased to say everything's going very well up to this point. I'd like you to indulge me a little bit because I think our story is that. It's a story of our journey, and I'd like to take you back about 3 years ago so you can see where we become, and then I'll end my presentation with a little bit of the operational analysis and the things that we're measuring to give you an idea of where we're at. Our implementation focused on our orthopedics department. It's called Advanced Orthopedics, Altru's Advanced Orthopedics Department. About 3 years ago, Altru purchased a second location, so we expanded off of our main campus to the south end of Grand Forks. With that, we really paused and thought, it's very easy when a hospital is growing out of space to just simply move a department. Let's move this, let's move that. But this really presented us with an opportunity to be visionary and what could we do for our community that was different than what Altru had already. So about 3 years ago, we began really visioning what we would like our new campus to be. So our vision became to be the region's premier orthopedic center. Grand Forks, like you just heard, is about 60 miles north of here. Altru Health System is a 250-bed hospital with a little over 4,000 employees. Our goal is to provide the region's premier orthopedics care to our geographical area. Our goal really was to have a collaborative team approach of orthopedic and hand surgeons, podiatrists, and sports medicine physicians treating all in one location. We really felt that this would give us great value add to our patients if they only had to come to one location to receive that care. So with that, we had the opportunity and we created a specialty center. In our specialty center, we have 4 operating rooms. We have 45 private patient rooms dedicated to our joint replacement center, our elective orthopedic procedures, and our inpatient rehabilitation unit, which is pretty impressive to have all those services in one location. On August 31st of this year, we expanded our Orthopedics Clinic and we moved that off of our main campus to complete our phase of meeting our vision and mission. We built 24 exam rooms, 7 cast bays, and 2 x-ray suites. As you can see some of the pictures there. We were very pleased to have some of the state-of-the-art equipment into our facility, which I'll talk about in a minute. And we were really excited to have a lot of patient engagement. So what brought us all together? When we moved, like I said earlier, we didn't want to just move our orthopedics department. We do that a lot in healthcare. We just pick up and we move. We wanted to create something new, and we felt we needed to do that not only with facilities, not only with brand new space, a specialty center, new ORs. We wanted to do that with a new brand to have people really understand what we are trying to create here is something different, something that's visionary. We brought new procedures. Our orthopedic surgeons, a couple things to highlight is the anterior hip approach, cartilage restoration, arthroscopic superior capsule reconstruction. Those are very important to patients that we are able to offer the new and latest, greatest technology. But from my perspective on an administrative standpoint, it's really important to talk about the partnerships we have. And as we heard from the speakers earlier, all of the people we truly do partner with, we learn from them each and every step of the way. Exos is a company we have partnered with for human performance, and obviously InSites Technology and Bailey are 2 partners for this project. So we're really pleased to bring a collaborative approach to what our new vision for orthopedic care is. So stepping into about 6 months ago, our selection process is a little different than what you heard earlier. We had the support of our C-suite immediately. Dave Molman is the CEO of Altru Health System, and I would consider him a very visionary leader. He's very invested in technology. He believes that that is the wave of the future, and we're very fortunate to have that. So from an administrative perspective, I didn't have a huge sell. I didn't have to present a huge pro forma and what the ROI is going to be on this investment. Dave knew the pressures that we are all facing in healthcare, reimbursement pressures. All of us know what's coming. We have CG caps in the ambulatory setting. We need to have more patients, but they have to have a great perception of their care. We need increased efficiencies. We know that there's a limited workforce facing us. Right now, as of yesterday, there were 708 nursing positions open in the state of North Dakota. And Grand Forks' unemployment rate is 2.3%. So as you can imagine, recruiting those positions is very difficult for us. So how can technology help this? Dave wanted us to look and step outside of what our normal processes are. We have a great department, a PI department that helps us look at lean, but we were missing a key component, and that's what InSites was able to offer us. In March of 2015, we internally, led by our PI team, began to work on workflow redesign in preparation for our new facility move. We knew that there was opportunities to do things differently because our space was going to be laid out differently. We were going to have the opportunity for nurses and orthotechs to be right in suite together. We were having new digital imaging technology, which was going to process patients faster. So we knew internally that we had some opportunities for process improvement. So we began that work in March. In June, we finalized our contracts with Intelligent Insight. And from that point forward, it was a full court press. We really dove immediately into the operations and the workflow planning, really looking at the blueprints from our facilities. I really felt it, along with our team, we were faced with a couple great opportunities. We had new technology, we had new space, and we had new processes. And I specifically say that these were new opportunities because we had phenomenal staff engagement. And as you see, I say that that is a must-have. And when I look at staff, I think of a couple different things. Because we had senior leadership support, we needed to have our staff engaged every step of the way. And with staff, I'm including physicians in that bucket as well. Our physicians played a very active role. I think what we did up front was bring them in March and let them see the system. We talked about what we could do differently, and we listened to our team. The nurses had very simple requests. I mean, our manager of that area let them look at the architectural drawings. She let them pick the ice machine that they wanted. That builds trust along the way, and that trust got us to where we were with the engagement. If I had to think back as a key learning opportunity, I would have said that we could have partnered closer with InSites early on. If you can see from March to June, we did a lot of work that ended up into somewhat rework because we were able to identify better opportunities moving forward. So I would say understanding your technology and partnering early with InSites was a key learning opportunity for us. I just wanted to give you a couple pictures of our new space where, like I said, from the staff perspective, being able to be close to one another was really important from them. We designed rooms that would allow patients to self-room on one side and then staff have an off-stage area, which was appealing to them to be able to work in close and to collaborate. So I just wanted to give you an opportunity to look at that. So where are we at now? Right now, like I said, we're 4 weeks and 2 days into going live. We have not moved backwards, happy to say. First day, we had a couple sticky notes on the door with physicians wondering which room they needed to go in next, but by the end of the day, that was done. So we are very happy with where we are right now. But from my perspective in administration, I'm lucky, like I said, that Dave Molman was a supporter of this project, but we do need a return on investment. We do need to move forward. We need to address those operational efficiencies. We need to prepare for difficulty in recruitment in those key positions. So I'm very happy that InSites partners with Eide Bailly. I think this is a very visionary partnership that will only help leverage both the technology and the operations moving forward. We've partnered with Eide Bailly and begun 2 projects. One, on the operational level, they're helping us identify some of those key metrics that we maybe didn't have early on. We could tell you we thought our patients were sitting in the waiting room too long, and we knew that because of our CG CAP scores with physicians' offices. We could tell you that we thought we had some operational improvement for room utilization, but we also have physicians who like their specific exam room, right? So iBailey is really helping us leverage what the system and InSites can bring to us. They're giving us our operational level metrics. They're working with our Kaufman Hall, our Epic, and our Lawson system in order to help us identify what's going forward. So the partnership, in the 4 weeks that we've been live, we've been able to pull data for a specific physician that will tell him how many minutes. He spends on average 13 minutes in the room with his patient. We can tell you today that our wait times for radiology is on average 10 minutes. This is going to allow us to set what metrics we want moving forward. And we're very pleased about that. I had the opportunity to bring our board through our advanced orthopedics department yesterday, and they were very impressed by this technology. They see too, as Dave's vision, that this is the wave of the future. We now can make educated decisions based on what InSites technology is able to offer us. And for staff, it keeps them engaged. It keeps something in front of them. We have not had any issue with tracking, feeling like we were tracking people, because we set the stage up front of this is just an improvement to what we do every day. And our physicians, we're able to give them the data that they want in order to keep them engaged moving forward. And so we're looking forward to the next years to come, and hopefully I'll be able to come back onto stage and share with you where we are a year from now. So thank you for listening to Altru's Journey with Advanced Orthopedics.